near the washer. You see that?
Yep. I don't know why I started that.
Hey guys,
Hi!
what are we talking about today?
What about healthcare?
Let's start by debunking a couple of myths. Myth number 1, Americans have access to the best healthcare in the world. Fact, at best, healthcare in the US is average, and among developed countries, we are actually often ranked worse or last.
Myth number 2, other countries have free healthcare, but they pay more in taxes for it. Fact, in the US, we pay more in taxes for healthcare than Canada, Germany, Great Britain, or Australia, but we receive no universal coverage.
Now don't misinterpret that to mean that we think universal healthcare is the solution. Maybe it is, maybe it isn't. But what it does mean is that we pay more than anyone else for healthcare and we don't receive the best care. Or best anything.
Now that that's out of the way, let's talk about healthcare and early retirement. Our current situation is pretty simple. Because I'm 26, I am still covered under my mom's plan until the end of the year, and Mike has a plan through the healthcare exchange.
It's a bronze plan.
Yeah.
But people are often quick to point out that things are not always going to be so simple. Right now we're young, healthy, and have no kids. In early retirement, we could easily spend our entire nest egg on one trip to the hospital. So what are we going to do? Well, first I'd like to point out that the fear of losing something is not a good reason not to pursue it. I'm always amazed when people dismiss a lofty goal like financial independence because what if economy, or what if healthcare, or what if taxes? I don't know what if. What if it turns out everything goes according to plan and our life is totally kick-ass? I don't know.
Okay, say everything goes according to plan. What is that plan exactly? Well, it is a three-pronged approach to healthcare and early retirement: traditional health insurance, medical tourism, and preventative care.
Let's start with traditional insurance. Now, the Affordable Care Act, or Obamacare, or whatever you want to call it, is actually a surprising gift for early retirees. Before it, getting insurance without an employer-sponsored plan was pretty much impossible or prohibitively expensive. That's a little bit problematic if you are people who don't intend on being employed forever.
While I can see how the Affordable Care Act seems a bit unfair for younger people, if you're a younger person who decides to save up a big pile of money and live off the dividends, it's actually a good deal.
That's because, like most tax incentives, the subsidies for the Affordable Care Act are based off your income and not your assets. In other words, you can have $1 million in the bank but only earn $25,000 a year, therefore qualifying you for pretty substantial subsidies. Now, before you go screaming in the comments about how unethical it is to take a subsidy even if you can afford full price, we'll say this quickly.
In our mind, the healthcare subsidy is a tax credit, not a handout. And the Supreme Court agrees.
We wouldn't pay more in taxes just because we could afford to, so why wouldn't we accept the healthcare subsidy? Second, it's not like the middle class is paying for those subsidies. It is hospitals getting paid less, which is always a good thing, and businesses making more than $250,000 a year profit. But most importantly, prong 2 and 3 of our plan mean we'll hopefully be using very little of our coverage and actually end up paying more into the system than we would take out.
Let's explain why. A large part of our plan is medical tourism. When we're no longer required to work, we're no longer required to stay in one location. For any elective procedure that can be scheduled weeks or months in advance, we plan on traveling overseas where healthcare is better and cheaper than in the United States.
Remember myth number 1, we do not have the best healthcare in the world, and for the privilege of being one of the worst, we pay almost double what almost anyone else does, sometimes much, much more. For example, a $50,000 knee surgery replacement in the US would cost about $11,500 in Costa Rica. A $2,800 dental implant costs $900. Keep in mind, the World Health Organization has determined that Costa Rica has better health care than the United States. So this is technically an upgrade, not a downgrade in care.
And while this is the hospital you probably have pictured in your mind, this is where you'll actually be staying.
We're hoping, though, that trips to the hospital, either home or abroad, will be less frequent because preventative care is on our minds now.
We're betting that good diet and exercise will mean that in our old age we'll have less doctor visits, prescriptions, and procedures.
We've made a conscious decision now that we want to age gracefully and healthily.
And as early retirees, we will have even more time to eat better, exercise more, sleep more, and have less job-related stress in our lives.
So to recap, by choosing elective procedures overseas, eating a healthy diet and exercising, and having Obamacare to fill in any gaps, hopefully in early retirement our budget will not be overshadowed by healthcare costs. And this is not an original idea. People have been doing this for decades and writing about it.
Check out Go Curry Cracker and Retire Early Lifestyle for more information. Now, this approach is absolutely not for everyone and will probably be a huge turnoff for some people.
But the point is, we're willing to make it work for us, and we're not trying to convince you to do the same. This is just an explanation of our early retirement healthcare plans for when people ask.
Sure, we're probably just a couple of naive 20-somethings who are going to have to face reality sooner or later.
But there is a pretty big community of expats that says maybe we're not. Only time will tell. Bye, guys.
Bye!